Months ago, when COVID began, we gathered in daily and weekly webinars experts to make sure that the Hispanic community was informed, was coordinated, and was up to date about the things that we could be doing to address this issue, knowing that we were disproportionately affected. We gathered an incredible panel of experts that week after week came and started looking at updates and information on health, geopolitics, policy, and small business matters. I am pleased today to have this panel of incredible experts joining again to look at the forecast of COVID 2021. Months ago, when COVID began, we began ourselves having a daily and weekly webinars to inform our Hispanic community leaders about the latest updates and information around the impact of COVID-19 to ensure that we were educated and equipped to make informed decisions throughout these uncertain times. We gather incredible experts to speak to the impact of the coronavirus pandemic on various sectors and industries globally, but also how they directly impacted our Hispanic community. I'm honored once again to welcome this group of extraordinary experts to share some of the latest updates and the current outlook for COVID-19 as we look towards 2021. For this conversation, I am pleased to introduce you to Dr. David Nabarro, Special Envoy of the World Health Organization, Director General of COVID-19, and the former boss of the former head of the 2030 Agenda of Climate Change when I met Dr. David Nabarro, now leading 4SD. Welcome, Dr. David Nabarro.
Hello, it's great to be with you all. Thank you.
Bret Stephens, let me welcome you, Bret Stephens, op-ed columnist of the New York Times. Welcome. Thank you so much for joining us again. Cristina Antelo, Principal of Ferox Strategies. Welcome. And Ramiro Cavazos, President and CEO of the United States Hispanic Chamber of Commerce, USHCC. So thank you so much, every one of you. We were together for a couple of months, even every Tuesday, giving updates to the Hispanic community. COVID is back. And I'd like to start this conversation by asking Dr. David Nabarro, thank you so much for joining us. We would be grateful to hear from you about the latest updates of COVID-19 on a global scale, and also to most important information that you believe the Hispanic community leaders and allies would benefit from knowing. Dr. David Nabarro.
Oh, well, thank you very much indeed. Hello, everybody again. It's wonderful to be reconnected. So this virus that we first knew about at the very end of December last year has not only caused major problems all over the world in the last 10 months, it is also surging back in a number of regions, surging back ferociously. And that means that once again, we have to be prepared to adapt our lives and make certain that the virus does not cause really high levels of suffering and even death. Three things about this virus. Firstly, we now know that even if you recover from the infection, there is a quite significant probability that that recovery will not be complete for a long time. You may have many months of continuing tiredness or discomfort when you exercise or other health problems. So I'm continuing to say to everybody, do not treat this as though it is a mild illness. Secondly, we do not have a treatment that can cure everybody, but we do know how to absolutely maximize the likelihood that people will survive. The understanding of what it takes to care for people with COVID is a lot better now than it was 9 months ago. Thirdly, we are better able to predict what options there are going to be for vaccination. We have 10 vaccines against this virus. that are going through the third phase of testing right now, and preliminary results suggest that 3 of these vaccines are highly effective. But we must wait a bit longer before really jumping for joy about the vaccines, because proper safety assessments must be done, and countries will expect to spend at least another month, perhaps 2 months from now, doing their safety studies, and only then will they license the vaccines for emergency use. And all of us want to be sure that if we are going to be vaccinated, that the vaccine is safe. Everybody, the way we deal with COVID is by defending against it. The defense involves us behaving in ways that make it hard for the virus to be transmitted. Remember, physical distancing, wearing face protection, really good hygiene of hands, face, and surfaces, and always trying to stay away from other people if you have symptoms. You've done this well in the past. Please continue to do it. And let's protect the people who are most at risk. I've said that this can only be done by everybody working together. The Hispanic community has set an example to the world. You have worked together to make certain that the COVID threat is kept as limited as possible. Please keep it up. Don't stop. Don't believe that this virus is suddenly disappearing. It's not. It's staying with us. And whatever different people in authority say, the one advice I'm going to give you is take this virus seriously. It's dangerous, and do everything you possibly can to avoid yourselves being infected and to avoid infecting others. Thank you.
Thank you so very much. We will have a conversation just after every panelist does an introduction. But you're right. The Hispanic community has taken it seriously, and the way that we were disproportionately affected and impacted at the beginning of the pandemic is not what the rates are showing now. We're more careful, and that is a good news. Bret Stephens, thank you so very much for being with us. Do you mind just giving us a reaction on the current impact of COVID-19 on geopolitics, and how does it look like for the future? How is this going to affect us?
Thank you, Claudia. It's a pleasure to be with you and other Hispanic leaders. Winston Churchill, at some point in his prime ministership, famously said, "This is not the end. It is not the beginning of the end, but it might be the end of the beginning." And that was my reaction when learning just this week that the Moderna vaccine has a 94.5 success rate, and Pfizer vaccine seems to have something close to it. And as Dr. Nabarro pointed out, there are other vaccines in the pipeline. Obviously, it is for all of us the first time we feel we have seen a light at the end of this seemingly interminable tunnel, but it remains just that, a light in the distance. And I think Dr. Nabarro's points about the importance, especially in the Northern Hemisphere as we enter a flu season and a colder season, of being extraordinarily cautious is a good one. My view of COVID is not strictly epidemiological. I think about it in terms of economic and political terms. The COVID pandemic has brought about the greatest economic shock that any of us have witnessed in our lifetime, dwarfing the Great Recession of 2008 and 9, dwarfing the oil crises, one might say, of the early 1970s. And I think those are shocks that are going to remain with us on a number of levels for a very long time. It is difficult to understate, and I'm looking forward to hearing Ramiro discuss this, but it is difficult to understate the extent to which the pandemic and the necessary lockdowns have been destructive to businesses, particularly small businesses, the ways in which they have managed to redistribute wealth in a manner that has exacerbated business and personal inequalities. It is striking to note that in the midst of what is a great crisis, economic crisis for millions of Americans, the stock market has continued to outperform historical expectations. And that is largely thanks to the success of a small handful of companies, digital companies, that have been able, by means of their size and by means of their advantages in the digital world, I'm thinking of companies like Amazon, to profit. I don't mean that invidiously, but profit from the pandemic, while small businesses have been decimated. And that is not simply a phenomenon in the United States. It is a global phenomenon. Economic crises of this sort invariably have political consequences. And when you look around the world, just take the example of Peru, which is now on its, I think, third president in just a week. That is obviously directly connected to longstanding issues connected to political corruption in Peru. But it strikes me as an observer that perhaps this would not be happening, or at least not be happening with this kind of severity, had it not been for the shock of the COVID crisis and the lockdowns that exacerbated it. Go to Mexico, go to elsewhere in Central America, and you are going to see this. You're going to see this phenomenon occurring again and again. There was an old saying that when the United States catches cold, the rest of the world gets pneumonia. Well, the United States got COVID, the rest of the world got COVID, and so we are in for, I think, a very long period of economic distress with serious political consequences. Not all of these changes, I should say, are necessarily going to be negative. Destruction brings with it possibilities for creativity. Destruction brings with it possibilities for new modes of connection. It brings possibilities for actually useful cost cutting. I think a great many businesses are going to start thinking about the necessity of having so much office space as they used to have in places, expensive places like downtown Manhattan. That's not always going to be a bad thing, but it is going to be a force for serial dislocation. Now, with the election in the United States and the return of a well-known, how shall I put it, stable and predictable political leadership in the person of President-elect Joe Biden, I think there is a belief that we are going to return to a kind of normality or normalcy, to use Warren Harding's notorious neologism. I think that is a mistake. I think President Biden is going to be confronting a series of rolling crises in his administration, all connected to the aftershocks of this crisis. The most immediate one, Claudia, is going to be the crisis of bankruptcies in municipalities, in cities, and states. That's going to be a major problem. A second one is going to be the increasing debt load throughout not just the United States, but the Western world, as governments have tried to keep economies afloat by using very easy liquidity, and that is going to have aftershocks as well. One only has to look at the effects, the long stagnation in Japan to give a sense of what that might be like, and there will be political consequences too. So I'll come back to what I said at the start of this conversation, Claudia. This is merely perhaps the end of the beginning, but the road ahead of all of us is going to be a long one. Look no further than the story of the 1920s, which emerged not just from the First World War, but also from the great influenza pandemic of 1918 to 1920. Those were years of accelerating turmoil. And I just hope that in this current crisis, we aren't going to experience the same trajectory again. Thank you.
Thank you so much. I can't wait for the discussion of the panel after the remarks from you and understand actually, like what we're talking about, the implications of bankruptcy and everything that you just mentioned. Cristina Antelo, principal of Ferox Strategies, thank you again for being here. Can you share new policy updates from the government, including and from the US government, and probably like the division right now, and how is this going to be affecting, and including how this changes new policies that will impact the Hispanic community as a whole and the new administration?
Thank you, Claudia, for having me back. One of the obvious things I need to address, when we last spoke was back in the spring, March and April, maybe going into May. But obviously, we've had an election now in U.S. politics, and that certainly changes the landscape and kind of relevels the policy discussion, in my opinion. Latinos, Hispanics made the consequential changes in several of these states, where the voting bloc unpredictable in a lot of ways, in a lot of policy areas and states that people didn't anticipate. And I think that is going to play itself out over the next couple of years. Now that I think politicians really start to learn that we are not a monolith and have failed to engage us in the past. And then they are not surprised when Latinos don't vote and say, well, they're the sleeping giant. They don't turn out. And I think that this was the election where we proved that wrong. And I think we proved that we are paying attention when we're engaged. What I am most interested in the next Congress is Latinos continue to increase their representation in Congress and in policy, not the least of which is the United States Senate. We added another Latino senator, and I think that when Kamala Harris goes to the vice presidency in January, California will have the ability to nominate another senator, and I have a strong feeling, or at least an inclination, that might be a Latino member, since California's population is over 40% Latino, and they haven't had a Latino senator. And so, to that extent, I am very happy that our numbers will have greater consequence in the Congress as policy discussions go forward. Specific to COVID, I think when last we spoke, we were talking about, Corona 1, Corona 2, Corona 3, and we kind of saw this endless number of potential aid packages that might be down the pike. But all of that ran into a brick wall over the summer. We had anticipated that there would be a summer package, a giant package, perhaps. In the House, they were up to over $3 trillion. And then the Senate put forth a package at a paltry $500 billion, and kind of addressing some of those topics that were already mentioned. The state and local governments needing aid weren't going to be addressed in the Senate bill, and some other specifics that would have benefited a lot of the constituencies that Democrats were looking to take care of, specifically adding more money for testing and adding more money for schooling, and across the board. A lot of those programs also that we were so excited about in the spring that were going to bring relief to Hispanic small businesses and Latinos that were unemployed. A lot of the funding for those has run out. The rest of the funding for those will run out on December 31st. There was hope that perhaps the package might come together before the election. You saw kind of this increased negotiation with Nancy Pelosi and Secretary Mnuchin, all to no avail. And now in the lame duck, a lot of folks are thinking that there's not a potential for them to get to a deal now either. And I think, some folks reading kind of what was mentioned again earlier in the stock market, like, well, if the stock market's doing fine, then certainly we don't need to invest too much money. No need to do a big package. And I think that's false. I think that, we saw 25,000 people come out for free food in Dallas over the weekend. And Congress needs to respond and needs to be able to add aid and help in ways across the country, not just, a couple of communities that are trying to bring it to themselves, and trying to kind of reallocate their resources. So going into now the new Congress in 2021, the 117th Congress with a Democratic administration, I have higher hopes that there will be a COVID package. I don't know that in this case it will be the rescue packages that we were seeing in the spring and summer, but instead now kind of the rebuilding, the Build Back Better that you've heard Biden talk about. So I can anticipate that we might have some COVID aid maybe mixed together with an infrastructure package. And I think that will be amazing for us. And I hope Ramiro will also talk about that, and kind of if there are allocated dollars that are for infrastructure, and infrastructure broadly defined. So not just highways like a lot of us might think of, but what does that mean in terms of broadband? What does that mean in terms of a great number of things for the United States, and water resources and things like that, all that impact our community, but also could mean jobs for our unemployed, as well as contracts for our small businesses. So my hopes are very high that this divided government in January will produce a big package like that.
Thank you so much, Cristina. Ramiro Cavazos, President of the U.S. Chamber of Commerce. There's so much that we would like to hear from you. So first, just like give us a sense of what was the impact for small businesses this year, and what do you think is going to happen moving forward?
Thank you, Claudia, and buenos dias to everyone. It is so important to bring people together. I just want to thank you, Claudia, and the members of our panel for what they've already shared that is so important to hear. The Latino business community has suffered greatly. I myself, like Bret, am a big fan of Winston Churchill. And one of the quotes that I'd like to use to describe the state of Latino business is a quote by Churchill that goes like this: "When you're going through hell, keep going." And one of the things that I want to stress is that initially, with the relief programs, the CARES Act that Cristina shared, the relief was put out into the communities, as many of you know, but many of our Latino and Latino-owned businesses were not the first recipients of those funds. And it was very well known that we only had about 30 days worth of liquidity because our businesses are the most vulnerable. 4.7 million Latino-owned businesses in America. And of those businesses today, easily 32% are closed permanently or temporarily because of this pandemic. And this pandemic, this worldwide recession, was self-imposed, as you know. It was to attempt to prevent the transmission of this virus. But it's very clear, because of a lack of political leadership in this country, that we have not stemmed the tide, as Dr. Nabarro said. The surge continues. This month of November is the worst month we've ever seen in the United States. And that's in the midst of 2 or 3 shutdowns or attempted shutdowns. So we haven't seen the worst of this. I think the real heroes are the small business owners who have survived, the 2 out of the 3 businesses who have adapted and have reinvented themselves using the digital age to provide goods and services. Most of our businesses, Claudia, are in personal services or in the food industry or direct immediate construction, and of course, healthcare. The real superheroes of this dilemma that we're all experiencing are our healthcare providers. More than 1 million are Latinos and Latinas, and of course the scientists, the vaccine production leadership that we're seeing. Those are the real superheroes that will come from this 2020 as the champions of our future. And the small business owners who are going through their own hell or have lived it, who are continuing to keep that entrepreneurial spirit alive. Cristina referenced it. The leadership in Washington has lacked maturity in coming up with a new stimulus package. We are tracking very closely 1 or 2 bills that we also were hoping would get approved before the election. But it's very clear that we're not going to see any progress on Paycheck Protection Program or the $1.5 trillion of forgivable loans provided to our small business owners that are still struggling and are still dealing with this pandemic virus. I will say this, that where the government has not stepped up, the private sector has shown tremendous investment in providing small business grants. Funds through municipal governments were referenced by Bret earlier. Governments are doing things they've never done before. School districts are putting up power cellular lines to provide access to their students for Wi-Fi. The acts of kindness that people have provided to one another, corporations and businesses and customers investing to keep businesses alive that they want to do business with. It is going to be the lesson learned by all of this, that the maturity, the resilience of our people globally is going to make us stronger. There's a saying in Spanish, lo que no nos mata nos hace más fuerte. That in Spanish, the saying goes that that which doesn't kill us will only make us stronger. And we are so strong because this is a community, Latino community, 61 million strong in America, community that on its own before COVID was the 8th largest economy in the world. This community is white, it's Asian, it's Black, it's poor, it's rich, and it's of every faith and of course, gender. And this community will lead us into the future because it will use what it had already gone through in the way of struggles and racism and prejudice. And Cristina is so correct. We are not a monolith. The elections prove that this community will do what it wants to do and believes in, regardless of the state, whether it's Georgia, Florida, Arizona, Texas, or of course, any other place that we dominate, not just today, but the future. So in conclusion, Claudia, it's an honor to be here with this distinguished panel. I am a glass half full person. I'm hopeful about the future that we will, under a new administration in January, see the recalibration of investment, not just in small businesses, in appointments that represent the community and from an ethnic standpoint, but also in infrastructure and a stimulus package that I'm excited to see, knowing that 8-10 years ago, the president-elect served in an administration that provided a reboot to an economy that needed it at that time. So on behalf of the United States Hispanic Chamber of Commerce, our chairwoman, Alice Rodriguez, and all of our members, our 260 Latino chambers around the country, we will continue to advocate for and fight for access to capital, contracts, and of course, the connections that we need in local and state and federal government to get the relief and the support that we all need for our nation's future. Muchísimas gracias.
Thank you, Ramiro, and thank you, everybody. I remember at the beginning of the year when Dr. David Nabarro said COVID is here to stay, that I didn't believe that we were going to be. I couldn't imagine that we would be in November and December talking about that again. And as Cristina said, yeah, that was a spring conversation, and we thought it was going to remain there. So knowing that it's here to stay, I would like to have your reactions to what one another said. Pick up actually the big themes that, like for one another. Do you really think that vaccines are going to change the future? And if so, how are we going to get our Hispanic community that's so scared of immunization right now, 40% drop this year, to move forward? Is the new administration something? Please, do you want to start, Dr. Nabarro?
Thank you very much, Claudia. Yes, I really do hope that vaccines will change the future. We've used them before in controlling viral diseases. The world has eradicated smallpox, which is a great triumph, through vaccination. And we've also almost eradicated polio, and we are doing pretty well on measles. But you're right. There is a growing concern about vaccines from lots of people, and you've already told me how recently the acceptance of vaccines among Hispanic people in the US has really fallen. I want to plead with everybody, do be open-minded about vaccines when you are offered them. They will only be made available if the scientists have convinced themselves that they are safe and effective. And please do what you can to maintain an open mind as you make decisions about yourselves and about your families. My own view is that in the end, it will be using a vaccine or several vaccines that we will stop this pandemic. And we have to find a way to stop it because it is causing so much personal, family, societal damage. You heard it from Ramiro. You heard it from Bret. You heard it from Cristina. We've got to stop it. And it may be, and I'm giving you this honestly, it may be the only way we can stop it is through a vaccine. So if you're offered a vaccine, think twice before you say no. Thank you, Claudia.
You know, Claudia, I would love to jump in there, because I do think kind of one of the important things from my point of view, you know, is that, you know, I've heard on the news the way they describe it is the vaccine doesn't save your life, it's the vaccination. And so you have to have it available to you. And part of that is that there's over 300 million people in the United States. And if you even get a vaccine that requires 2 doses, now you got to think about 600 million actual doses of a medication going from, you know, wherever they've created it to having it be produced, having it be shipped, having it then kind of reach you and then be able to be administered to you. There's a lot that goes on in that logistics chain. And, you know, until now, I don't know that we have, as the populace, gotten a lot of information about what the administration has been doing to prepare for that. And that is why this transition phase now between one government to the other government is so important. And the delay in that transition is very meaningful, because 60 days lost could be gigantic for us. I mean, even going down, I mean, think about the injection, the shot, right? The little rubber stopper that goes from when you push it into your arm, like that's a little piece of the supply chain. So if you don't have enough of the rubber stoppers, you don't have enough of the shots to go around. And so you've got to make sure every single piece of the supply chain is accounted for. And policy wise, you've got to make sure that production and the access to the supply chain is protected.
Can I ask Dr. Nabarro a question? You know, historically, the development of vaccines, effective vaccines, was a years-long and sometimes even decades-long process. And it seems that one very good piece of news or one silver lining in this crisis has been the unprecedented speed with which what appears to be not only one, but a set of effective and safe vaccines has been developed. What has the world learned this time around that it might put to use, Dr. Nabarro, the next time we are hit with a new virus that has this kind of consequence?
Oh, you're on mute.
Bret, thank you. Humans work best when they work together. As a species, we're designed to be collective and not to be individual. And so what we're seeing on this matter of vaccine development is a really good example of really high quality human practice. Businesses are working together, scientists are working together, and most governments are working together. 184 governments out of 193 are supporting a collective approach to vaccination called COVAX. It's wonderful. There are only a small number of government and government leaders that are behaving in a very individualistic way. The rest are working together. This is brilliant news for dealing with the damage to nature, for dealing with massive inequality, for dealing with climate change. We're going to need this capacity of collective human action. Don't get distracted by the terrible mess that some people are worried about right now in certain countries with a delayed handover of power. By and large, political leadership, business leadership, scientific leadership is cooperating like never before.
And action number 1 coming out of this panel, recommendation for all of the leaders, whether you're in the private sector, public sector, whether you're leading a small business, whether you're an entrepreneur, we should unite on making sure that Hispanics get vaccination access, that we have access to these when it's available. We are, as Ramiro have said, we were the last of getting, like financial packages because we don't ask for it. We're not up for it. This is one in which we should all try to unify, wherever sector you are. If you're Latino, you're an ally, we should be first and front and center asking and being first on row so that our community gets vaccination and this is important. Remember that at the beginning of the pandemic, 44% of Hispanics were in denial of COVID because we didn't get information. We didn't have the information, or we didn't have the luxury of actually staying home and not working. We have to actually make sure that this time around we're ahead of the curve. So action number 1 recommendation from this panel, would you say it is actually making sure that we work collectively to make sure that Hispanics do get vaccination, we get informed and get our employees, private sector, to make sure that whether, like wherever you are in the chain, you are pushing the agenda forward. Is that action number one that we want to recommend?
In my case, I want to say access to information, access to vaccine, and access to care for the people who've got COVID. Because remember, 1 in 20 people getting COVID have a long and difficult illness, and they need to be supported as well. Those would be my three: information, vaccine, and care.
Claudia, I would add a fourth, if I may, which is leadership. And when there is a safe and effective vaccine, and regulatory agencies have verified that, it's hugely important to get role models in the Hispanic community to be actively seen going and getting their shots. That PR campaign, that putting people, who you recognize and empathize and admire in front of TV screens, getting a needle stuck in their arm, I think that's going to be a huge piece of this in persuading people that it's the safe and the right thing to do.
Totally agreed, Bret.
Anyone else, Cristina?
I think the only other thing is I would be sure that we also, Latinos always kind of have that inclination to take care of those around them, that we need to advocate for those around us, right? Latinos are more likely to suffer from a lot of the underlying conditions that make us more susceptible to the COVID illness. Diabetes among them, and a whole host of others. Also, like our generations and what have you, we're more likely to be the ones who are taking care of our elders, our grandmothers, our aunts, our tias, whatever it is, and we need to make sure that we're advocating for them. So likely if there's only small amounts of vaccine available to the public at first, they're going to be for those that are in those categories of folks that are at higher risk. So we need to, even if it's not for us per se, it needs to be for our grandmas or whoever has the underlying condition. So we need to be advocates for ourselves in all of those conversations. Yeah,
but also, Cristina, in a new administration land, we need to make sure that, like those messages are heard and that we can get the packages that we need is, like on vaccinations, what else?
Absolutely, and that's certainly the hope. I hope that comes together. But if we're not out there, reminding folks not to take us for granted, then that's on us. So we've got to be a very active participant in that conversation.
Ramiro, action, solution.
Well, the solution, the two that I provide is let's hold the new administration accountable. Also, it's very important that we realize that the challenge that we're seeing, a solution is we need to make sure that the baton is handed off as quickly as possible to the new administration. I have two boys, a 6th grader and a 9th grader, and I'm impressed that their level of maturity compared to the existing administration in addressing some of the adult things that need to happen in life. What a poor example we're giving everyone around the world with this a clumsy transition in our democracy, and clearly it's an evolving democracy, like all of them in the world, all those countries that Dr. Nabarro works with, and you work with, Claudia. But what I would say is this: I have a mother, and she's in great health. We're very blessed. She's 85 years old, but I have not seen her in 11 months, and it's for the safety reasons that we've discussed until we get a vaccination. But I will say this, that the strongest asset that we have as a Latino and Latina community is the love that we have for humanity and for one another. And I believe that is the hope that I have. That is a solution that I have. And each of you referenced it, is we will persevere. We will get through this through science, through, of course, movement, through persistence, and through tenacity, and we should hold everybody accountable, Claudia, that we need to realize that just because there's a new administration, we need to demand that action take place, not just in America, but around the world, and snuff out where we can and call out not just injustice, but of course behavior that is not based on fact. And we need to rise up and do that as a community. And I believe that's the lesson in the comments made by each of these great panel members today, is that we need to continue to be honest in addressing the solutions to move forward beyond this virus, because it will be turning the dial, not flipping a switch. It'll take us 2 to 3 years to get back to normal economy around the world. And this is the first time in our history that the economy in the world has hit a recession at the same time. Usually it's been regions, Europe, while South America did well, or the US did well, while Asia did poorly. This is, all of us are in this together, and we need to work together, as Dr. Nabarro said, to find these solutions and be very actively engaged. Thank you.
Thank you so much. I will ask everyone just to give closing remarks, remembering that when we started these conversations in March, we started introducing, and it was you, Dr. Nabarro, with, I think that it was you, Ramiro, that started introducing this word, disproportionately affected. Hispanics are disproportionately affected. And we were able actually to unify the narrative so much that I think that everybody started using that as Hispanics are disproportionately affected by COVID, that helped us to ask for support. I would like to ask for closing words from every one of you, thinking about whether the narrative that we had about disproportionately affected still stands, or what should be the new tone that we have for our community to unify and start asking for the same. Dr. David Nabarro, closing words.
Thank you. I'm going to say that Hispanics have been worse affected than others in the American society. That also people who are Black have been affected worse, and we must remember that this is a real difference and we must focus on it. Secondly, Hispanics have been less easily able to access care. Hispanic Latinos in particular offer most of the care that's available, as we just heard. So it's vital that Hispanics are at the front and center of the response and make sure that they get access to everything they need to come through this and to come through it strong and bring the whole country with them.
Thank you so much. Bret Stephens.
I'll just say something very brief, Claudia, which is when I think of the Hispanic community in the United States in a single word, that word is resilience. And I think that is the quality that has carried through Hispanic Americans through countless trials and tribulations in this country. It's going to carry them through this crisis. And I do believe with, I think it was Ramiro who mentioned, I don't know if it was a Spanish saying or an English saying or a German saying, what doesn't kill you makes you stronger. And I do believe the Hispanic community will emerge from this trial stronger.
Thank you. Cristina.
You know, from my point of view on the policy side, my single biggest fear is that politicians will go back to business as normal, and unfortunately, the squeaky wheel gets the grease. Latinos engaged in a political way in this election cycle like they never have. And what I hope for our community is that we can continue to be engaged and we continue to be a squeaky wheel so that they pay attention to us. We are 18% of the population, and yet they continue to spend all their resources trying to go get the white disaffected mom in Ohio to vote, as opposed to catering to a diverse population in Texas and Florida, Arizona, Georgia, all of these places where we made a difference here. And if these politicians have to be accountable to us, if we force them to be accountable to us, then I think that we benefit. And I think that is the single greatest thing that we can do for our recovery out of this, not only our survival in the short term, but our recovery in the long term.
Thank you so much, Ramiro.
Claudia, sometimes storms get in our way, not to disrupt, but to clear the path forward. And 2020 is a year that has had multiple storms, and we will persevere. We will come out stronger. There's no question that economic development, commerce, free enterprise, entrepreneurship is the lifeblood of improving our quality of life as a global community. And we are going to adapt and come out stronger in years ahead. And I think the innovation that this vaccination to kill this virus or to stem it is proof positive of the miraculous things that can happen, not just in science, but can happen across other industries to allow us to reinvent our future and to adapt and to succeed and be stronger.
Thank you so much, distinguished panelists. Thank you so much. Actions and solutions, recommendations for Hispanic leadership done after this panel. I thank you so much for your participation. Thank you.
Thank you.
Thank you.
Goodbye. Thank you.
Adios. Gracias.
Bye.